Dame Cicely Saunders was a Christian woman who had training as a nurse, a social worker and a doctor. She saw people she loved dying from cancer and in terrible pain, and determined to act, she pioneered the modern hospice movement, developing what we know today as palliative care. In 1967, she opened St Christopher's, the world's first purpose-built hospice. Since then, over 200 hospices have been established across the UK, and palliative care teams help care for people in these dedicated facilities, as well as in hospitals and in their own homes. The aim of palliative care is to provide relief from pain and other distressing symptoms so that people with life-limiting illnesses or disabilities can live as comfortably and actively as possible. Ongoing research means that strong painkillers and other medications can now be used effectively to control and limit physical suffering, without the expectation that people have to tolerate side effects which are as bad as the symptoms themselves. Sad stories we've all heard about families or friends who've died in terrible distress and pain, or rendered unable to function by morphine and other drugs, should now be a thing of the past. I've come to the offices of Care Not Killing to interview its director, Dr. Peter Saunders.
Care Not Killing is an alliance of about 50 organisations that was set up in 2006, and it includes professional groups like the Association for Palliative Medicine, all of whom have come together with three aims. Firstly, to oppose any change in the law to allow euthanasia or assisted suicide. Secondly, to promote good palliative care for the terminally ill. And thirdly, to try and change public opinion on this whole issue.
The focus of palliative care is to enhance the quality of people's lives. So, as well as addressing people's physical needs, palliative care aims to address their psychological, social and spiritual needs as well, caring for the whole person and their family and carers as well. Because many people will experience these problems early on in their course of their illness, palliative care is not just something for people who are imminently dying. Supportive care should be offered as soon as there is a need to address. And so palliative care teams, particularly those based in hospitals, will often meet people very shortly after their diagnosis. Care of this kind is offered hand in hand with active medical management aimed at controlling the disease itself. Lights will guide you home and ignite your bones, and I will try to fix you. Thanks to many who have carried on the work that Cicely Saunders started, the quality of palliative care is very good. But whilst in some areas of the country palliative care teams are very well resourced, in other areas its availability can be patchy. Inadequate training means there are still many health professionals, doctors and nurses, who lack knowledge about how to use strong painkillers and other symptom control treatments effectively. In many areas there aren't enough professional carers to ensure that people can be safely and sufficiently cared for in their place of choice. Palliative care for cancer patients is particularly good, but for those with other illnesses, heart, lung and neurological diseases, specialised palliative care is underdeveloped, and resources aimed at improving it are insufficient. Cicely Saunders' compassionate and practical response to the suffering of others led to her vision, caring for every aspect of a human life as it approached death. But the fear of death is instinctive, and so the task is unending. Christians opposed to assisted suicide need to understand and to offer our wholehearted support to the progress of palliative care.
And I will try